Welcome back. Now I'm joined by Jocelyn Hubbard, a social work care coordinator from St. James Hospital. Thank you for being here, Jocelyn.
Thank you for having me.
Yeah, it's great. So we just heard from a community health center about how they deal with social determinants of health. You're coming from one of our larger health systems in Montana. Talk to us about what you do with social determinants.
Yes, so although I work for a large health system, SCL Health, we really are mission focused and driven to treat each patient individually, to look at each patient's needs, to address each of them in an individualized care plan, to make sure that we are addressing both their physical, emotional, mental health, as well as other social needs that might arise for them.
A clinical social worker or a social work care coordinator is not someone I typically think of as being involved in a patient's care. Can you talk to us about that role?
Yeah, so we wear a variety of hats in a clinic setting. Everything from, educating our providers and our nursing staff on what resources are available to patients, because they might not be aware of different food sources to help people who have food insecurities or housing options. So letting them know what resources are in the community, educating them, as well as then meeting with the patients individually, and assessing, talking to them. We screen, do universal screening in our clinic, so we meet with everyone and screen them, for all sorts of things, whether that's food insecurities, housing issues, do you have insurance? Can we help you, connect you to that? Do you need transportation? Is that maybe why you're not getting to appointments? So we help with those, and then once we identify those needs or those risks that could affect their health and their ability to make appointments or to keep track of their health, then we kind of try to set them up with resources, and we do follow-up care and check-in calls, or make sure that we are doing really wraparound care of our patient and their families as well.
So beyond the social care coordinator role, what other professionals do you work with to help these patients?
Yeah, absolutely. So in our clinic, we have, obviously the provider, which can be an MD, a DO, or maybe a nurse practitioner or PA, their nursing staff, and then we have behavioral health specialists, so maybe that person's going to kind of step in and help more with depression or anxiety, or work with a behavioral health concern to address that might be affecting the person. And then we also can, we're moving towards having pharmacists actually in the clinic, to help when a patient is prescribed a new medication, to answer those questions with maybe the provider present as well, so they can talk about risks and benefits a little more, how it might, possible side effects, or how it might interact with what they're currently on. So they're not going to the pharmacy and hearing this stuff and then calling back to the doctor, that we can kind of address it when they're there and help them with that.
What types of issues are you seeing as the most common in the folks that you're treating?
So I work primarily with just OB patients, so mothers who are expecting, and pediatric patients, but I believe that what I'm seeing is probably what every person in my role is seeing throughout the state. We see a lot of poverty, a lot of homeless issues, a lot of food insecurities, lots of drug abuse, mainly meth, amphetamine, and bute. We see a lot of generational situations, so families who have been involved in different systems. Maybe that's Child Protective Services for, their parents grew up in foster care and now they are. And so how to kind of help break that cycle and change it so that moving forward our generations are doing better and they're at home and not having the trauma affected by them.
As you're working in your own environment, what else are you doing with other organizations in the Butte area?
Yeah, so we connect with lots of social services organizations. I meet monthly with a variety of them. I meet with Child Protective Services, our home visiting programs that come in and do, nurse visiting. They do parenting education inside the home and safe care. We meet with, our housing people that are supplying our housing, and just try to connect and create relationships. So we work closely with Montana Chemical Dependency Center, which is the state chemical dependency treatment facility. It's located in Butte, so we try to coordinate care, and if they have patients that need care while they're there, they can come to our clinic and get medical care aside from their addiction issues as well.
How do you see this overall approach that you're doing, this combination of a whole bunch of different resources? How's that really helping the community?
I think it's making an impact already, but I think that we have yet to see what wonderful things will be completed or accomplished with this type of care, treating the whole person instead of, why you just have blood pressure. We're looking at the whole picture of the person, and we're having really great success, and we're seeing good outcomes. I think initially people are a little nervous if they have never experienced someone other than a doctor or a nurse at a clinic. They might think something is wrong, or they might be concerned about having this third or fourth person come in. But I'm hoping that the more that we talk about it, the more that it's just part of the care that they receive, and it's just standardized care, that they're comfortable and that we're able to help these people that maybe haven't been able to be helped in the past.
In the few seconds that we have left, can you quickly describe a success story?
Yes, absolutely. We've had lots of success. Like I said, I work mainly with OB and pediatric patients. Recently, we were able to coordinate care with Child Protective Services, Montana Chemical Dependency Center, and help a woman who had never been able to parent successfully get into treatment. She was able to come to our clinic and get her obstetrical care done. She was able to complete her treatment. We were able to help the staff at MCDC and theirs to get her to a mother-child facility where she is now parenting her child without the involvement of Child Family Services. So, that baby probably would have been removed. So we are doing
great success story. Thank you for that. Great information, Jocelyn. Up next, we'll talk with Kristen Schuster, a healthcare transformation consultant with Mountain Pacific, about some of the big picture changes happening in primary care across Montana and elsewhere.